Thank you for being here. November is National Caregiver Month. So I want to ask this question. How many people in this audience, we still have people coming in, how many people in this audience are a caregiver or have ever been a caregiver? Oh. Look around, folks. And that's just this room. So what if I said to you, there's 1 million people out there in the United States providing care to people. Would you think that's a lot? Oh, Mary's way off. What if I said 10 million? 20 million? 30 million? 40 million? Get up there, Mary. 50 million? No, 63 million people are providing care to loved ones, neighbors, good friends. We call that family caregiving. How many people in this room are a direct care worker or a direct support professional? Anybody in this room? For those of you who are out live streaming and watching, I know there are direct care workers out there, and I know there are direct support professionals out there. This is National Caregiver Month, and we salute you for what you do. Because those people make it possible for people to live in the community. I got another question for you. How many people have always wanted to live in a nursing home or an assisted living facility? Wait a minute, I just saw a whole bunch of hands go up, and now I don't see any. Nothing wrong with them. That was always a very big part of my career. They're fabulous for people who don't have a caregiver, for people who can't live in a nursing facility, they can't afford it, or people who just want to be close to their loved ones. So we salute those 63 million caregivers who are out there making sure that somebody gets to live at home with other loved ones. These people are doing things like helping them dress, helping them move about, getting to doctor appointments. That's pretty important. They're cooking. But you know, that also goes beyond that. Hygiene. Some are doing tube feedings, injections, respiratory treatments, wound care. All of this is going on in the home by people who are not necessarily professionals. They've left the hospital or the doctor's office and they're told this is what you need to do. 24/7. It makes a difference to their employer. We lose billions every year in the loss of people at work because they're doing something else. They're doing something important. They're keeping somebody close at home with love and support. So we are honoring those 63 million. I mean, can you imagine this? 63 million. So today this is what today is about. Today is about honoring direct care workers, direct support professionals who help people with disabilities. They support them to live in community, to work in community, to engage in community. So you're going to hear from caregivers today. You are going to hear from care recipients today. You're going to hear from national leaders of organizations that are here today, all part of that village it takes to make this wonderful caregiving value and force so important to this nation. If we didn't have them, 63 million, where would they be? Because we know our healthcare system can't support an additional 63 million people. So let's start out today with this individual. I'm going to introduce two people. Lily Liu. If you don't believe in dragons, you will very soon. and Nicholas Smith. Nicholas is a direct support professional. He has worked for over 25 years with individuals with disabilities, keeping them in community. He was so excited about being here today, but because he couldn't find someone to take his place, he didn't come. That's what you call love and loyalty and dedication. But we have been provided a video, so you will get to hear from Nicholas Smith. So Lily, come forward, Dragon Lady.
Thank you so much. Good morning to all honorable guests this morning. Thank you so much, Administrator Lazare, for your gracious introduction, and more important, for your beautiful framing of the situation that family caregivers and caregivers of all types face. It is truly my honor and privilege to be here today. Thank you and your amazing team for the invitation to bring the lived experiences and the voices of caregivers, family caregivers and caregivers of all types, to this important gathering during this commemorative month. And gratitude to all the federal and local agencies, as well as the organizations, foundations, and others here in person and virtually, hello, for all you do to support us family caregivers. I don't usually use notes, but today I want to make sure that I hit key points. I am grateful that storytelling is included today. I believe stories are a powerful way to inspire action as we work together to build a healthier, better future. Data and statistics are important, but stories help to make the issues real. This is my family caregiver story among the 63 million that exist today. I always say when you meet one caregiver, you meet one caregiver. I appreciate, as Administrator Lazar mentioning, my evolving from a dragging caregiver to a dragon daughter caregiver. As you can see, I am rocking some flashy bling. This is a 3-inch red dragon. Now, I'm not auditioning for that Netflix show, Bling Empire. I'm wearing this pin because it symbolizes how I evolved from the dragging caregiver, dragging with fatigue, dragging with worry, trying to navigate that fragmented healthcare system, juggling calls between doctors, insurance, pharmacies, but I became a dragon daughter caregiver. And I became empowered because of the information, benefits, and services that I found, which many of you provide for us caregivers. Such resources ensured that I could have agency. I thank you. My family caregiving journey just spanned like everyone else's. First, the initial long-distance caregiving, going home to my childhood home to check on my aging parents. And then the shock of a diagnosis of a terminal illness for my father, an acute illness. And then once he passed away, the care for my mom, who had had Parkinson's for over 40 years and then Parkinsonian dementia. Then I had experience with a chronic illness, a degenerative illness. Like millions of the family caregivers across this nation, my hands-on caregiving came about suddenly, without any preparation, because of a health crisis, the losing of my father. I was not prepared at all. This is a key reason why I now am an advocate for family caregivers. I am committed for helping those coming on the journey behind me and also thinking ahead for myself, as I inevitably will need care, just as all of you probably have that same thought. As a single working woman, I did not have what I call extra hands on deck here in DC once I brought Mom here, nobody to help me. But to fulfill that Chinese traditional virtue of what we call filial piety, xiao in Mandarin Chinese, caring and respecting for our elders, I left the workforce earlier than planned. I could better care for Mom, who was totally dependent on me. For a few years, I did hire some paid care workers to help me for some hours so that I could run errands, but our finances were limited. And during the years of the pandemic, I don't know how many of you might have done this, but I cared for my mom behind closed doors in an 857 square foot apartment to keep out the virus all by myself 24/7. Let me answer 2 questions that illustrate how I could evolve into an empowered family caregiver. What did it mean for me to be able to access services and supports that promoted mom's independence, her dignity, and also would support me and my own health? Now, I am resourceful, but I stumbled and bumbled around for a long time before I learned which agencies could actually help me, which organizations could help me, the caregiver. Fortunately, neighbors who had gone through caregiving told me about the DC Department of Aging and Community Living, DACL, which has an Aging and Disability Resource Center. I then found the lead agency for my ward and through it a wealth of resources and services to help me. There are services that others like Mom and others could benefit from, a nutrition program which toward the end of Mom's life actually provided pureed food. There's also that reduced public transportation program for older adults, and a service that's really unique to DC if you don't know about it, the Family Caregivers, the DC Caregivers Institute. It has training for us caregivers and even financial resources that help so much. And their virtual caregiver support group really helped me, especially during the pandemic, to help me fight loneliness and isolation. I was among other family caregivers and, had a sense of community. So now when folks around the country ask me for tips as they begin their caregiving journey, I immediately say, look for your area agency on aging. Use the elder care locator. It's the best way to start to find the benefits and services available to you. Question number 2, what were the barriers? What limited us from accessing the supports and services? Now, I host 2 very interesting virtual caregiver support groups, and they meet monthly. So I'm now going to be able to share not only my experiences, but those of the folks that participate in my caregivers group. As a caregiver from a multicultural background, I know there are linguistic barriers to access services. There is a need for information in languages other than English, not to mention a glossary, which I've always prayed for, of all the acronyms that are used in caring for our elders, ADLs, IADLs, UTIs, MRIs, et cetera, we all need an interpreter for medical speak. Now, the barriers that others face are also things like Jennifer, who's in one of my support groups. She lives in a rural community and faces tough transportation issues, such as the lack of public transit in rural Virginia. And I also do wish to say that, please don't just tell us to go to X, Y, and Z website, www.something. That's not really helpful because we have to navigate online, even as every hour we have family caregiving work. And of course, we must remember that not everyone has affordable access to the internet. I really dream of what I'm calling a grab-and-go, one-page resource page. I know today that there are many fellow caregivers joining us virtually. I just want to take a moment and say, I see you, I honor you. It is a tough and lonely road we travel. Let me add my thanks to you for all you do every day. I hope you will all join me in seeking out useful information, resources, supportive home and community-based services so that you too will become empowered and evolve into family caregivers who are dragon caregivers. I know that this ACL, this Administration for Community Living, will continue to seek our suggestions to help support us as we take care of our loved ones so that all Americans can live independently in our home, in our community as we age. And we are so fortunate, Administrator Lazaire, because we have a strong champion in you. So in conclusion, I would like to present to you this red dragon pin. Thank you for your support for us family caregivers across this beautiful nation. Can we take a picture?
Thank you.
I want a picture.
thank
Yeah.
you.
Thank
There
you.
we go.
Thank you.
Here, come here.
Oh, yes, there she is. I do want to make sure that she has that. Is it upside down? Oops, no, it's good. Thank you so much, Minister.
Thank you. Lily, thank you very much.
Thank you.
Ready.
Hello, my name is Nicholas Smith, and I am proud to serve as a direct support professional, DSP, at Spin in Pennsylvania. I worked in this field for over 25 years supporting people with intellectual disabilities and autism to live meaningful lives in their communities. I also serve on multiple advisory and leadership bodies, including the PA Department of Human Services, ODP, Information Sharing and Advisory Committee, PAR, and the Direct Care Workforce Strategy Center Advisory Committee. How I found this work. After attending Penn State, I started my career in manufacturing, but the work wasn't fulfilling. I later joined a youth service organization, and it was there I discovered my true calling, helping people thrive. When the organization closed, I joined SPIN. I was offered a management position, but I chose the DSP role because I wanted to work directly with people. That decision changed my life. What it means to be a DSP. DSP support every part of a person's physical, emotional, social, and personal needs. I've been there for people through their major milestones, like getting their first job and through difficult moments like illness and loss. Early in my career, I supported two men with serious mental health and intellectual disabilities. One had been rejected from several jobs, but finally got hired at a local deli. We talked a lot about staying positive, moving forward, and that's what I'm trying to bring to everyone I support. The work requires skill, patience, compassion that far exceeds compensation, and it never stops. DSPs often work 65 to 70 hours a week, picking up extra shifts to make ends meet. We attend countless meetings, house meetings, planning sessions, family discussions because we are the link between people, families, and the systems that serve them. I have participated in several trainings and educational programs like National Alliance for Direct Support Professional eBudge Academy. These credentials show that we are competent, trained, and qualified professionals, not just workers filling the shift. The profession requires continuous learning, empathy, and deep commitment to quality care. At SPIN, I am fortunate to have a strong support like staff deployment department that finds coverage if I'm sick or need time off. Not every DSP has that. All care workers deserve sick time, health care, and safe workplaces. I've been lucky to avoid workplace violence, but I know many DSPs who haven't. Safety, respect, and supportive management are essential for sustaining this workforce. I'm a single father and I work long hours to provide for my family. I often miss family events, vacations because I take extra shifts to cover expenses. I love my job and the people I support, but it's hard to stay in a career that doesn't pay a livable wage. The average DP wage nationally is $15.43 an hour. Many of us work 65 to 70 hours a week just to afford rent and groceries. We train new hires constantly, only to lose them to higher paying jobs in retail or food services. The workforce crisis is real. In Pennsylvania and across the country, there are long waiting lists for home and community-based services because there simply aren't enough workers. This crisis affects everyone, individuals, families, providers, and the entire care system. Supporting DSP means ensuring that people with disabilities can live as safely, independently in their communities, not in institutions. In closing, DSPs are essential professionals who deserve respect, protection, and competitive wages. Investing in this workforce isn't just the right thing to do, it will allow people with disabilities to live a full lives and families to trust the care system. I'm proud to do this work, but I know it can't continue to rely on personal sacrifice. Thank you for recognizing and uplifting direct support professionals who make community living possible every day.
So now I'm going to call two other speakers up on stage. First, Jason Resendez, who I affectionately call Jason Relentless. Jason is, as you can see, CEO of the National Alliance for Caregiving. Jason's organization, and under his leadership, he's got his finger on the pulse of caregiving, family caregivers in this nation. Jason, please come and join us. On my left, your right, is Barbara Merrill. Let me just tell you very quickly, when we spoke to Barbara on Thursday, maybe Wednesday, Barbara says, can you give me 24 hours? I have to. She was in Connecticut or in Maine or something at a funeral service all day long. Then she had to drive to Maine. Then she was leaving to go to a board meeting the next day, and she said she was trying to figure this out, but she did it because she said, this is too important of a topic to miss. Barbara, we thank you for the work that you all do and the great data they provide on direct support personnel. You're going to hear from these two national leaders. Jason, thank you, sir. Barbara, come join me.
Wonderful. Thank you so much, Administrator Lazaire and the ACL team, for this opportunity to say Happy National Family Caregivers Month. We are living through a profound demographic shift. Every single day, roughly 10,000 Americans turn 65. Medical advances mean people are living longer than ever before. This is a tremendous achievement, an example of American ingenuity. But it also presents new challenges, challenges that largely fall on the shoulders of an often invisible workforce, America's family caregivers. Today, we celebrate the more than 63 million Americans who form the backbone of our nation's healthcare system. And these aren't just statistics, as Lily so beautifully reminded us. These are our family, our friends, our neighbors, our coworkers. They fill our churches, our schoolhouses, our workplaces. And their numbers are growing. According to the National Alliance for Caregiving and AARP's landmark Caregiving in the U.S. 2025 project, nearly 1 in 4 Americans is now a family caregiver, representing a nearly 50% increase from just a decade ago. That's 20 million more Americans providing care today than 10 years ago. This surge directly mirrors our aging population and a critical reality. 70% of older Americans will need some form of long-term services and supports during their lifetime. Family caregivers provide the bulk of this care, delivering comprehensive, complex support that would otherwise require a team of paid professionals. 70% monitor their loved ones' health conditions and adjust care accordingly. Nearly 2/3 communicate directly with healthcare providers, serving as a crucial link in care coordination. More than half perform complex medical and nursing tasks, administering medications, managing special diets, and providing wound care. Many provide around-the-clock care for people that they love. And here's what we must understand. Family caregivers are essential to healthcare delivery. They don't just supplement it. They enable something Americans overwhelmingly desire, the ability to age and receive care in their homes, in their communities, surrounded by what's familiar and meaningful to them. This matters for 2 fundamental reasons. 1, freedom and dignity. When people remain in their own homes, they maintain control over how and when they receive care, and importantly, who provides that care. These choices profoundly impact quality of life. Second, basic economics. A year in a nursing home costs about $120,000. Home-based care, about $47,000. That means we can support more than 2 people at home for the cost of 1 person in a nursing home facility. When family caregivers provide much of this care with the adequate, appropriate support, the savings can multiply. But family caregivers can't do this alone. We must recognize that family caregivers and paid direct care workers exist on a continuum, not as separate systems, but as complementary parts of a whole. Many family caregivers rely on professional workers for respite and complex tasks. Similarly, direct care workers rely on family caregivers for continuity and personal knowledge. Our research confirms this reality. 11 million family caregivers receive some form of payment for their care, demonstrating that the boundaries between these roles are fluid. When we strengthen one part of this continuum, we strengthen the entire care ecosystem. Supporting both isn't choosing between options, it's investing in an integrated approach that works. Yet, this system is currently failing the people who run it. Despite their heroism and economic value, family caregivers face a crisis of strain. According to our research, 60% experience high emotional stress, 45% face physical strain, and nearly half experience at least one negative financial impact. Lily stepping back from work is an example of that. And caregivers of color, LGBT, and rural caregivers disproportionately face these negative consequences. This is not sustainable. Our nation's family caregivers need concrete support to continue this essential work. Access to home and community-based services, workplace flexibility, paid leave, tax credits, respite care, and strong Medicare and Medicaid programs. Right now, we have a broken system where institutional care is often treated as an entitlement, but staying in your own home requires navigating waiver programs and waiting lists and restrictions. We need to flip this paradigm. The right should be to remain in your home with institutional care as the option rather than the default. The data reveals how far we must go. Just 12 states spend at least half their long-term care dollars on home and community-based services for older Americans. That means 38 states spend the majority on institutional care. In these places, older Americans, people with disabilities, and their family caregivers simply don't have options to stay at home. Transforming this imbalance requires more than incremental policy adjustments. It demands a fundamental reorientation of how we think about care itself. Rather than continuing to prop up an institutional-first system, we must build from the ground up what families need and what the evidence shows us works best. The National Strategy to Support Family Caregivers provides our roadmap for this transformation. It recognizes a simple truth. We cannot build a healthier America without standing behind the family caregivers who make it possible for millions to live with dignity at home. This strategy translates that recognition into action across aging, chronic illness, and disability, across the private sector, across states, across philanthropy, and across political divides. The National Alliance for Caregiving has been listening to family caregivers and tracking their needs for nearly 30 years. Our research confirms what we know in our hearts. These are ordinary Americans doing extraordinary, indispensable work that benefits all of us. So as we recognize National Family Caregivers Month, let's be clear about recognition truly means. It's not enough to celebrate caregivers 1 month while leaving them to struggle for the other 11. Real recognition is action. Real recognition is investment. Real recognition is restructuring our systems to match our values. The path forward is clear. We have the research, we have the roadmap in the national strategy. What we need now is the collective will to prioritize care as the foundation of a thriving society, not as an afterthought, but as essential infrastructure. When we support family caregivers, we're not just helping 63 million individuals, we're strengthening the foundation that allows all of us to age with dignity, to care for those we love, and to build communities where no one faces the hardest moments in their lives alone. Every one of us will either need care or provide it, most likely both. The system we build today is the system we will depend on tomorrow. So let's get to work. Thank you so much.
Thank you, Jason. Good morning. I'm Barbara Merrill, Chief Executive Officer of ANCOR, the American Network of Community Options and Resources. We are a national nonprofit association representing more than 2,500 private providers of community-based disability services for people with intellectual, developmental disabilities and autism. We also represent 59 state-level provider associations. Together, we work to advance the future of services and supports for people wherever they live. And that's what makes today's convening so timely. National Family Caregivers Month is a time to lift up the important and often overlooked role of family caregivers, it's also a poignant moment to examine our nation's caregiving infrastructure more broadly and how we can deliver meaningful options to people with IDD and their families. As an association of disability service providers, we recognize each person's needs are unique and that everyone should have options and resources for deciding how to meet their needs. It's why a core part of our work since the turn of this century has been to strengthen the nation's workforce of direct support professionals, or DSPs, to ensure that people with IDD and their families have an array of support options. But for the past 3 decades or more, there's been a significant shortage of direct support professionals, meaning that too few people and their families who need services can get them. There's not a week that goes by when I don't hear from our members about the incredible but undervalued work carried out by our nation's DSPs, like Nicholas. The work of a DSP includes supporting people with hygiene, nutrition, and other activities of daily living. But it goes well beyond that. DSPs help people with IDD find and maintain jobs that fuel local economies. They support family caregivers to remain in the workforce. They support people to volunteer in their communities and leave a lasting positive impact. They make it possible for people with IDD to register to vote and get to their polling places on Election Day. They support people to connect with new friends and reconnect with long-lost relatives. In other words, DSPs like Nicholas truly do it all. But nor is there a week that goes by when I don't hear about tremendously talented DSPs who love their jobs but leave our field because they can't figure out how to make it financially. Routinely, we hear stories from our members about DSPs who work 2 and even 3 jobs because they don't earn enough to support their families. Meanwhile, providers desperately want to offer better wages, but lacking the funding to do so, they commonly report that no one applies for open positions because potential direct support professionals can earn several dollars more per hour working in either fast food or retail. ANCOR's early advocacy to address this growing crisis coalesced into a full-scale effort in 2001 when we launched the National Advocacy Campaign, a nearly 15-year initiative to increase funding to improve wages and further strengthen the profession. In 2007, we began our annual DSP of the Year Awards to raise the profile in front of lawmakers of the exemplary work that DSPs carry out each and every day. From 2018 through 2020, the Anchor Foundation's Included, Supported, Empowered campaign sought to raise public awareness so that more Americans understand the immense value that DSPs bring to their communities. And just this year, we were delighted to launch our DSP Ambassador Program, which is providing intensive spokesperson development training to an inaugural cohort of DSPs from around the country who are actively working to demonstrate the value of their work. These initiatives are just a small sample of our efforts over the years, and while they've undoubtedly had an impact, there's been no match for the overwhelming reality, which is that decades of insufficient investment in IDD services have left providers unable to offer wages that allow them to compete for talent against other hourly wage industries. Although we know the workforce crisis is severe, there's a lot we don't know. In part, that's because federal workforce data does not yet formally include DSPs among the nearly 900 professions listed in the federal government's occupational classification system. That's why ANCOR has long supported policy to address the creation of a standard occupational classification, or SOC, to address and we remain hopeful that DSPs will be included. The next cycle is in 2008, and we are advocating strenuously, and we invite you all to assist us in this important advocacy to include DSPs in the standard occupational classification. But we do have a reliable source of data. It comes from the National Core Indicators, or NCI, and that describes the scope of this crisis. NCI's most recent State of the Workforce Survey, which reports data from 2003, finds that community-based IDD service providers are experiencing turnover rates averaging 40% nationally, while about 15% of direct support positions at their agencies remain vacant. 15% of the positions remain vacant. Some of these statistics shouldn't be shocking, considering that NCI also reports that in some states, the starting wage for a DSP remains below $10 an hour. These findings confirm what ANCOR has known anecdotally for years. Nevertheless, not all that long ago, we lacked a clear picture of the impossible choices confronting disability service providers as they grapple with how to address high turnover and vacancy rates. For that reason, in 2020, we launched an annual survey known as the State of America's Direct Support Workforce Crisis. Now in its 6th year, this annual data collection asks providers about the true impact of ongoing recruitment and retention challenges. Our 2025 survey garnered responses from almost 500 providers across 48 states and the District of Columbia, the findings of which we released 3 weeks ago. This year's survey paints a bleak picture, finding that 88% of providers reported experiencing moderate to severe staffing shortages in the past year. Moreover, 62% of providers reported they had turned away new referrals, while another 28% reported discontinuing existing services to people they are already supporting. And among the respondents that delivered case management services, nearly 6 in 10 struggled to connect people with services due to a lack of available providers in their area. Even though these statistics are chilling, there are reasons to remain hopeful for a better future. One reason I remain optimistic is because I've seen firsthand how, time and time again, community providers rise to overcome seemingly insurmountable challenges. This is made possible not only by their tenacity, but also by their spirit of innovation. For example, ANCOR collaborates with the National Alliance for Direct Support Professionals and the UCED at the University of Minnesota to co-present the Moving Mountains Award. These awards are issued annually to recognize pioneering approaches that stem the tide of high turnover and make meaningful improvements in the workforce crisis. Through our partnership, we learn and we showcase initiatives that utilize career ladder programs, explore advancements in technology, including artificial intelligence, engage multi-systems partnerships, and more, all to improve wages, to operate more efficiently, and to enable people to live more independently. While these private sector innovations are worthy of celebration, we know that the change we seek is massive, and we can't do it alone. Another reason why I remain optimistic about the future of our workforce is because we have so many dedicated partners in the public sector, partners like the Administration for Community Living. We are so grateful for ACL and for your focus on ensuring a more sustainable service delivery system by improving our national caregiving infrastructure. Today's convening is an excellent example, bringing together many of the country's leading experts to examine the state of family caregiving is critically important because, absent a robust network of paid professional caregivers, millions of disabled Americans find themselves relying on family members for care, and family caregivers deserve all the support we can offer. And so I end my remarks today with a heartfelt thank you for your partnership in addressing this critical issue together. I'm really optimistic that we can find and move forward in meaningful, measurable ways. Thank you.
Thank you to you, Jason Relentless. And Barbara, we appreciate your partnership as well. Thank you for all the travel you went through to get to us today. Next, let's hear from two other individuals. First is Kelly Lamb. Now, Kelly, you're going to hear about this. She runs miles beyond any of us, miles to go before she sleeps. A pole vaulter, a runner, marathon, full-time career, and caregiving for her husband. There's nothing sheepish about Kelly Lamb. That was a good one, wasn't it? I get one a year. Thank God it's November, almost missed my year. Number two, Dr. Jean Goldie Sanitate. Is her headshot up there yet? No. Wait till you see that headshot. That'll be something interesting. She is a client participant in the Veteran-Directed Care Program. Our phenomenal partner, the Veterans Administration, has been collaborating with ACL on this program for many years. When I was here during the first Trump administration, there were about 62 VDC programs across the country. Now, because of this great team and the great team from the Veterans Administration, we're at 160 plus programs. With tremendous client satisfaction, I have met so many of these veteran caregivers and recipients. It just blows your mind how fantastic that program is. So I want to thank Dr. Jean Goldie Sanitate for being here to tell us about this program, and for you, Kelly Lamb, please come forward. Thank you.
Hi, everyone. I'm going to apologize in advance. I am one to speak more off the cuff because this is my personal story with caregiving and disability. As Administrator Lazaire said, my name is Kelly Lamb, and I live in Little Rock, Arkansas with my husband, J.D. Bruning. He is a C4 quadriplegic, and our story with disability began in 2013. We had just graduated the University of Arkansas, which was also the last time our football team was relevant, and we were beginning our careers. He was staying in Northwest Arkansas to begin a commercial real estate career, and I had moved to New York City to join corporate America, and we were going to figure out the long distance on the way. And so we were thrilled to embark on life, and just a month and a half after that, he sustained a spinal cord injury from a diving accident in southwest Missouri on a river. This was obviously incredibly traumatic. I received a call in New York from a hospital in Joplin, Missouri, to which my partner told me, I'm never going to walk again. And that's really when reality set in. He was then life flighted to Little Rock, where we had a fantastic team at UAMS that stabilized his spine. And from there, we were very fortunate. He was still under private health care insurance through his parents. He had not aged out yet. And so we were able to travel to a model rehab hospital in Atlanta, Georgia, where he began his rehab. And we really got a crash course on what it's going to look like to come home. Again, it was so imperative that we were at this facility because our home facility could not have given us the skills and resources for what we needed to do before we came home. And from there, we began his recovery and rehabilitation. We decided that it was best for me to stay in New York City to further my career. And he moved home to Little Rock, Arkansas, where his parents became his primary caregivers for the next 4 years. And he focused primarily on rehab and working out and trying to regain as much function as possible. He was fortunate. He did regain some function. He has strong biceps, but he has no hand function, no trunk function, no leg function whatsoever. And so really, we were like, what does the rest of our life look like? How can we be financially viable as a couple together? And during this time, I experienced a great amount of grief. I saw it mentioned in the remarks that family caregivers experience much higher rates of depression, and I was experiencing that living in New York City, trying to be an emotional support to him, as well as provide care when I did come home to Little Rock to be with him. As a result, as Administrator Lazaire mentioned, I looked for a coping mechanism. And for those that know New York, you know the New York City Marathon is a marquee event. I'm not a runner. I had never run over a mile, but I got this crazy idea that I was going to do a marathon and it was going to make my life better, and boy, did it. I knew that I would not be committed to just the physical challenge of running a marathon, so I needed the support of a team, and I wanted to support an organization that supported individuals with disabilities, and in particular, those with paralysis. And that's where I found the Christopher and Dana Reeve Foundation. So I signed up for their team, Team Reeve, and the rest was kind of history. I ended up doing 6 marathons in 5 years. My husband is very loved, and this organization is very well respected, and we were able to personally fundraise over $100,000 for paralysis research. And thank you. But beyond the coping mechanism of running and remaining physically and mentally healthy, the greater gift I was given was the resources in the family that came from the Christopher and Dana Reeve Foundation. We were immediately integrated into their Paralysis Resource Center, which is in fact a one-stop shop for those that need help with any mobility impairment. It does not have to be spinal cord injury. It could be ALS, MS, spina bifida, cerebral palsy. We see so many inquiries from stroke patients as well. These individuals, our information specialists, became our lifeline through everything we did. Eventually, I relocated back to Little Rock. And as you guys can imagine, Arkansas is a rural state. We do not have the same access to healthcare resources, even living in the hub of Little Rock. With paralysis comes a lot of very difficult secondary conditions. Honestly, the secondary conditions that my husband has experienced are far worse than not being able to move his body. Shortly after I moved home, he had a stage 4 pressure sore that we could not get healed. He was on total bed rest, did not leave the 4 walls of his room for 2 years, except to go to the wound care doctor. He lost his job, and we really were at the lowest point of our entire journey with his paralysis. And I don't know why I waited as long as I did. I turned to my friends at the Paralysis Resource Center, and I said, what do we do? We had a phenomenal wound care doctor. She was literally trying to move mountains, but my husband would not heal. And sure enough, one of my now colleagues, Bernadette, who has decades of experience as an information specialist, she sent me a laundry list of questions to ask my doctor. She said, have you thought about this approach? Have you thought about this test? Sure enough, those suggestions, and that inspired our doctor to go a different route of healing, and that is what led to the healing of my husband. Without me reaching out, I don't know where we would have been at this point. Eventually, I was very fortunate, and probably because I was a pretty good fundraiser, I came on full-time at the Christopher and Dana Reeve Foundation. I'm now a director of development for their team, and it truly has been a life-changing experience, not only to serve this organization, but this community. Caregiving is a very isolating experience, especially when it starts when you're 23 years old. It's hard, And we know that we have a long, long road ahead, especially as my husband begins to age. But this organization has given us truly invaluable resources. They've given us community. They've given us a constant backbone that we can go and ask for second opinions and get connected with other caregivers and mentors. My husband, I'm so happy and excited to share that because of the support from Reeve and mentors that we met along the way, he decided, I think I can go to law school. This was never a career ambition of his before he was paralyzed. He was disappointed with his career options after his paralysis, and so he decided to take the LSAT. We were connected with some really great mentors that were quadriplegics and lawyers. He was able to request all the accommodations that he needed. He graduated at the top of his class, and now he's a barred attorney in the state of Arkansas. And again, none of this would have been possible without this community and the support of the Reeve Foundation, but more importantly, without the support of the Administration for Community Living, which is how our Paralysis Resource Center is funded. We could not be more grateful for this partnership, and I want to just say thank you again. It is such a privilege to be able to speak on behalf of caregivers and the entire disability community at large.
Thank you. You were awesome. Thank you. Amy is coming forward. Jean.
Right here. I'm going to use my notes because I have a TBI, traumatic brain injury, and I'm glad people use the acronyms before because I got lots of them. Being in the military, you always have. Don't start me yet. Okay. Anyway, you always use acronyms. My husband's not here today, who is my caregiver. Unfortunately, we have 2 dogs that have anxiety separation. But I do have my nurse extraordinaire that I had in Delaware for skilled services, Grace Shaw, down there. Hi, Grace. Okay, I'm going to start now, okay? I'd like to introduce myself and give you a bio. My name's Jean Goldie Sanitate. I'm also known as Jersey Jean, as I do a lot of adaptive sports. Kelly, I'll take you on someday. Anyway, it was my acquired sports name. I grew up in the Pine Barrens, and so I'm considered a piney, a Pine Barrens of New Jersey, so that's hence the Jersey Jean. I was active in many sports and also got another nickname, OLPM, an acronym, which stands for Our Lady of Perpetual Motion. I do not sit still. I adored one of my uncles, Uncle Kel. He was a general in the U.S. Air Force. He was a West Point grad, civil engineer. And when we visited him in Langley, I got to sit on the LEM, which is back in the 60s, which went on the moon. By the way, I'm 70 years old, so I'm an oldie, but a goodie. And I grew up very patriotic. And after such the adoration I had for my Uncle Kel, and seeing that he had traveled all over the world, which my dad used to call me a gypsy, I decided to join the Air Force, to travel, get my education paid for, and basically to serve my country. And women are always volunteers. We were never, because I actually joined in the time of the draft. I'm a proud disabled woman veteran, or basically, as I just prefer to call myself, a differently abled veteran. I don't have a disability, I have some problems, but I have to use things differently abled. I served in the U.S. Air Force from 1976 to 1984 as a optometry technician and a medic. And I was medically retired for spinal cord injury, T12, and also found out that I had MS prior to the T12 injury. The MS started in 1984, and I was misdiagnosed till 1998. I suffer from comorbidities, which are additional issues that are related to a spinal cord injury and or MS. So, got double wham from Uncle Sam, I say. Anyway, those who served in the military know that we have an ingrained sense of a mission. Always have to have that mission. After I got out of the service, I went from job to job to find a niche that I really enjoyed. I worked with a Fortune 500 company in sales. Next, I worked in special education as I have an undergraduate in special ed. I taught male juveniles ages 12 to 17 in a residential setting for New Jersey Department of Corrections, basically Camden, New Jersey's finest. Car thieves, drug dealers, assault. We got sexual offenders in, I left, I was gone. After that, I finally worked in what's called a VHA, Veterans Health Administration, MCCR. It's basically billing. The VA bills patients to use the VA services, which a lot of people are not familiar with. And it's MCCR stands for Medical Cost Care Recovery. And if they have insurance, they bill the insurance. If they're over a certain percentage, then they don't have to pay the veterans to go there. While working there, I was able to identify and create solutions to make the system more veteran-friendly, and also found a way to bring in more money. We had a lot of people that would just resend to the insurance company. Well, I found a VHA directive, or actually Title 38, that said that the insurance companies were required to pay us. So I got bills reimbursed 3 to 5 years back. So brought in a pretty good chunk of change there. After that, with urging of the last optometrist I worked for, Dr. Wong, when I was in the Air Force, she said, go back to optometry college, because I was telling her, oh, I miss it, I love it. You know, it's like always been in my heart. So I did. Luckily, I applied to an optometry college and was accepted in MS, Master's of Science in Vision Rehabilitation and Optometry Doctor degree. After I graduated from there, I worked with 2 ophthalmologists in Philly. Oh, God. Oh, I'm not even halfway through. Okay, anyway, sorry. I have tons of you. Stay on track. Okay. TBI, sorry. Don't take that time. Okay. Anyway, let's see. Where I worked in the VA Blind Rehab Center in a VA medical center. During that time, I was experiencing more mobility issues and finally found out I had a patient that had MS. And the team member, because we're a multidisciplinary team, and that's one good thing about the VA. They have multidisciplinary teams in blind rehab, which started after the Civil War, and they have multidisciplinary in spinal cord injury, which is wicked awesome. So I talked to the neuropsychologist on our team, and he said, get a head to toe with gadolinium for MS to rule it out. And I came back. It was like Christmas up there. I had light lesions like crazy, all the lights in my head. Anyway, let me see where I can cut out. I don't know. Anyway, we moved. My husband, I'm good, okay. My husband worked for the federal government, and he was an IT specialist for IRS, and they have a great division called appeals, so you can appeal your whatever. He was actually in charge of workstations for the whole nation. And he actually took early retirement because my MS symptoms were getting worse. I was getting into secondary progressive. So we ended up moving to Delaware because taxes were cheaper. Tell me when I have to cut it.
I'm going to let you finish with your husband as your caregiver.
Okay, my husband's my caregiver, and I call him the Hubs. His name is Jim. I wish he was here today. But anyway, he would tease me. Oh, I do everything around here. And it was a joke, you know, but it hurt me because I understand caregiving, and it is a drain on him. And he does, I can see when he's overwhelmed. And he basically has to sometimes, he does a lot for me. I mean, what he does is unreal. He keeps me, he fills my pill container, reminds me to take the pills along with Alexa and one of our dogs, because he doesn't like Alexa speaking. And he cooks, he goes to the grocery store because it's like impossible to find a handicap accessible spot. He goes to the grocery store, prepares and cooks our meals. He helps me with ADLs, I want to nature TMI, sorry, specialized care. And he does a lot. And the one thing I will say, thanks to Bay Aging, and it's called Veterans Directed Care, which is now So I actually have somebody who's trained, does the services for me, and I'm not switching. Grace was my nurse in Delaware, and I had 3 nurses, which was good. I was lucky, because you have a new person coming in all the time, and it's really tough. Let me see what else I could throw in there. I don't know. Anyway, sorry. Typical MS brain. Anyway, this is the real important part I wanted to talk about. This right here are some of the adaptive sports I got into, and I want to give a big shout out to the National Disabled Vets Winter Sports Clinic, which did my kickstart to adaptive sports. I have done many and everything. And let's see. Yeah, I got them. I wanted to talk about the spinal cord centers because they are multidisciplinary. I have great, Richmond is a spinal cord center, and we really need to make sure that that's not taken away. Because as a wounded warrior or veteran, I have pre-existing conditions. So I am uninsurable, or insurance would be extremely prohibitive cost-wise. And I am on Medicare now because I'm 70, and but certain things I have trouble getting things done. But the VA, through coordinating with direct care, veterans care, sorry, brain, hang in there. You can do this. Anyway, I just wanted to stress that the VA spinal cord centers are very vital because they actually help veterans be able to go out in the field to work, adding to our economy, like I think it was Ms. Lou, did you say that? Yes. And adding to the economy and the tax base, don't forget that, we pay taxes. And also to help us not be a 121. Now I'll explain what that is. Basically it's veteran suicide, where you feel you're a burden, you just overwhelmed and just, feel there's hopelessness, loss of life. This stuff right here saved my life, literally. Because I had to have a mission. I lost 2 major careers. I don't count the teaching one, but my, blind rehab career and my career in the service. Because I was injured, when I was injured, I was medevac back to my base, which was a small hospital, and they were going to send me to Fort Gordon. I said, "You're not cutting me." They said I would never walk again. Well, I did for years because I ran before, cycled, and now one of the things like my hand cycling, that was the Warrior Games that went up there, the Olympic Training Center, because it's part of that. We have hand cycling, I swam, and they were making fun of me because I was the old lady at 55. And the old lady got 2 gold medals. So, and this is, I have a better golf cart. This is a winter sports clinic here where I was doing Nordic biathlon. That's where my Sherpa, as I call him, he got me up with it's called a slider. It's a walker with skis. And I have a leg brace for my accessory leg, as my one doctor says. This one doesn't work. This one does, so. And this was a golf clinic. And let's see, I think that's, this was the Veterans Wheelchair Games. And I got to meet my idol, Rocky Blyer, because I'm a Steelers fan. So anyway, sorry. I hope I got everything.
Jean, thank you very much.
Thank you, Marilyn.
She's a testament to, no, I'm saying you are a testament to the beauty of the VA programs and the services that they provide. My experience many years ago, when I was here with the first Trump administration, was to work with the fabulous team at the VA who we collaborate with on the Veteran-Directed Care Program and who also connected me to the great work of Senator Dole Foundation, tremendous caregiving efforts there as well. So now, let me introduce to you 2 other national leaders. One is Wendy Grage Fox. Wendy is one of these people where, that term, where in the world is Waldo? We're like, where in the States is Wendy? because Wendy is working with the state health policy and continuously on the caregiving side from state to state to state, helping to build that infrastructure. So we'll be happy to have Wendy join us. The other is who I call the Energizer Bunny. Ramsey Alwyn is the CEO of the National Council on Aging, a fabulous partner to the Administration for Community Living. You will hear some other tremendous updates from both of these ladies. Thank you, Wendy. Thanks for being here.
Thank you so much.
Yes.
Well, good morning, everyone, and thank you for that wonderful introduction. Hi, everyone. I am Wendy Foxgrage. I'm a senior director at the National Academy for State Health Policy. It's a nonprofit, nonpartisan organization, and we're of, by, and all about state health policymakers. We're very proud to host the RAISE Act Family Caregiver Center. It's a private-public partnership of the John A. Hartford Foundation and the U.S. Administration for Community Living. And a big shout out to the John A. Hartford Foundation because it really was their brainchild. We have two major activities of our center. One is about states. We provide TA and resources to states to better support family caregivers. The second major activity is that we help two U.S. advisory councils of the RAISE Act and supporting grandparents raising grandchildren to create and now update the national strategy to support family caregivers. I know Jason spoke a little bit about this national strategy, but let me give you a little bit of background about the strategy and the advisory councils. So the national strategy to support family caregivers was created to support caregivers, but of all ages, from youth to grandparents. And it's not just a federal government approach. As Administrator Lazaire was saying, it takes a village, right? And this is a roadmap, not only for the federal government, but for states, localities, communities, and the private sector. The strategy was developed jointly by these two advisory councils created by the RAISE Family Caregiving Act and the Supporting Grandparents Raising Grandchildren Act, but with extensive input from the public, including family caregivers and the people they support. And now the strategy, it was released originally in 2022. It is meant to be a living, evolving document, and it is currently being updated. So why do states care about this? And how are states and localities and the private sector, how are they using this national strategy as a guiding framework? Well, across the nation, state health policy programs, or all programs really, depend on caregivers who are providing critical support. And the caregivers that we've heard from today who've told their brave stories really illustrate this, right? They're providing really amazing support to help relatives, friends, neighbors, and they're often the ones that make it possible for people to age in place. And they contribute about $600 billion in unpaid healthcare services. That's B with a billion, so it's a chunk of change. So right now, my organization is working very closely with 13 states who applied and were accepted into our state caregiving learning collaborative so that they can learn from each other as peer-to-peer support as well as subject matter experts. And we're using that national strategy to support family caregivers as a framework. So I want to talk about some solutions. Here are 5 solutions that the states are engaged in. Number 1, outreach and marketing, because we know that family caregivers often don't self-identify. They see themselves maybe as a spouse or an adult daughter. So, and they often do not know where to turn for support. 2, better engagement and assessment and support for family caregivers' own needs. We tend to focus on the person that they're caring for. And by the way, that's caregivers too, right? They're so focused on the person they're caring for, it's selfless. But now turning the tables and making sure that they're getting the support that they need. Huge thank you to the Administration for Community Living, for the Technical Assistance Center, for the National Caregiver Support Collaborative that we're providing wonderful resources, and we're really proud to partner and work on the caregiver assessments and resources. Number 3, services. You've heard a little bit about it from the caregivers. Services such as respite care, which gives caregivers a much-needed break. And training, because many of them are providing very complex medical tasks and other types of services. Again, a big shout out to our partners working on Respite Care, our Respite Care Association of Wisconsin, Arch Lifespan Respite Network, PHI, and again, the Administration for Community Living for their partnership and their expertise in this area. 4, financial supports. 7 out of 10 family caregivers, they're juggling work and their caregiving. We can do better. And 5, better data, outcomes, research, and evidence-based practices. And guess what? All 5 of those solutions are goals of the national strategy. It really is a great roadmap. There's great momentum. There's great, we've got momentum, but there's still so much more that we can do. We can do better. I want to end by giving you a heads up and a bit of a teaser. So those advisory councils, as I said, they're working on updating the national strategy, and they are considering adding a new Goal 6. It would be a new focus to strengthen the direct care workforce. That's home care, home health, personal care, nursing aides, just like Nicholas. And to talk more about the states, the direct care workforce, and more is our next speaker, Ramsey. Thank you all so much for having me. Appreciate it.
Well, thank you, Wendy, and thank you, Mary, for bringing us all together. What a great way to celebrate caregivers this month. Mary, thank you for your leadership and your foresight in really elevating the issue of caregiving, paid and unpaid caregivers, a cornerstone of the backbone of our healthcare system, our caregivers. And your forward-thinking leadership and commitment bringing us here together, making caregiving a priority for the administration helps ensure we fulfill our promise to older adults and people with disabilities, so all can age well. Now, at the National Council on Aging, we're proudly celebrating 75 years of impact, 75 years committed to ensuring all can age well in America. Our mission is focused: improve the health and economic security of 40 million older adults by 2030. And over the many decades of our service and our advocacy, we have always worked with our federal partners, community-based organizations, the private sector, and other key stakeholders to address issues critical to ensuring all can age well. As founding members at NCOA of the Generations United nonprofit and a current advisory board member, we are extremely supportive of the recommendations Wendy shared and the updates regarding the Advisory Council to support grandparents raising grandchildren. We're also very excited about Wendy's recognition that we need to expand the caregiving priorities to include direct care workforce. We're especially excited that the RAISE Advisory Council is considering adding the direct care workforce to its agenda, and we look forward to coordinating our efforts there. We know the U.S. is facing an unprecedented demand for caregiving, fueled by the rapid growth in the aging population and the rising number of people living with disabilities. Yet we also have a shrinking pool of available direct care workers. This workforce, which includes home health aides, personal care aides, and other frontline caregivers, is the backbone of our nation's healthcare system. And as we've heard today from family caregivers and direct service providers, caregiving and the caregiving system operates at the intersection of health, family, and community. At NCOA, we're honored to lead the Direct Care Workforce Strategy Center, supported by the Administration for Community Living. Working directly with states and other key stakeholders, we are developing innovative solutions to support millions of Americans who rely on this workforce every day. to support their ability to live with dignity, independence, and safety. Thanks to the administration and the Administration on Community Living specifically, their continued support and leadership is allowing us to currently support 17 statewide collaborations, providing them technical assistance and peer learning. We've supported 28 statewide collaborations over the last 2 years through the Strategy Center. And through our efforts, states have expanded the table, including critical partners that have not traditionally been engaged collectively in these discussions and these issues. State workforce agencies, education departments, transportation, and other supportive services coming to the table with state units on aging, with Medicaid offices, and so many others. Essential whole-of-government approaches that they are taking at the state level. Working with our partners like PHI and the National Governors Association, the Strategy Center provides subject matter expertise to analyze and to catalyze bold ideas to reshape the future of caregiving. Some of these innovations include empowering states to understand their reimbursement rates across the full continuum of care, working with managed care organizations to collect critical data about the direct care workforce that ultimately empowers the state to eliminate silos so that all the relevant government agencies can use and access data, making informed decisions and maximize those taxpayer dollars. And creating pathways for Gen Z and Gen Alpha to enter the caregiving workforce, such as engaging through the Department of Education and beyond middle school students and high school students in understanding the care economy and its many opportunities. These are just a few examples of innovations happening at the state level that we're proud to raise up, share, and cross-pollinate across the states. The Strategy Center is committed to making the data the primary lens that guides state strategies and decision-making. Over the next 2 years, the Strategy Center looks forward to engaging with the administration and partnering with governors to make strengthening the direct care workforce a priority in all 50 states. Because what's emerging is clear. The direct care workforce isn't just vital to caregiving, it's foundational to the broader U.S. economy. And states that engage, they get it. They see the need to support a robust direct care workforce, which supports family caregivers, which empowers families and their caregivers to continue to stay in the workforce. States are moving from ideas to action, refining what works and laying the groundwork for durable change in areas so many of you've worked on for so very many years. Today, I'm pleased to share with you our latest development. We're launching a new on-demand technical assistance offering that will provide short-term support to help states addressing emerging policy and programmatic areas. This comes alongside our already proven State Advancement Lab, which continues to deliver meaningful results for participating states. We're now at about the midpoint in our journey with the Strategy Center, expanding our focus, building on what's working, and accelerating resource development that will support the sector as a whole. So this year, you can expect over 36 tools and resources that will highlight models ready for broader adoption, state highlights in regard to innovations, and other innovations across the sector from community-based and providers. But one resource I'm particularly excited to share with you today and give you a little sneak peek to the forthcoming series of reports on artificial intelligence. There's a lot of buzz around AI. It's an ever-evolving technology and tool that can be leveraged for caregiving and for person-centered models of care. At the Strategy Center, we want to see how AI can enhance job quality so that we can expand person-centered models of care in-home and through community-based services. We're working to deepen the conversation about AI, distill the hope from the hype and the harm as we explore how AI can support a strong direct care workforce and expand access to coordinated person-centered services. We hear from family caregivers. Family caregivers increasingly want AI tools that reduce stress, that provide guidance and support decision-making. We aim to guide and inform the development and usage of these tools. So as we explore these applications, a few of our early insights I'll share with you today. First, AI exists at the edge of assistive technology. Generative AI plus assistive technologies working together can enhance job quality. This is about augmenting the human work rather than replacing it. AI has already begun to transform home care, streamlining administrative tasks, enhancing safety through tools like falls detection and monitoring, and supporting workers with training and predictive analytics. We urge all involved in the creation of AI and the administration to ensure that all Americans have access to these new cutting-edge tools, especially those in rural areas. There's so much opportunity if we get it right. And we stand ready to continue our partnership with the administration to ensure all of the insights we're gathering through this analysis inform targeted investments around AI and other tech innovations. At NCOA and the Strategy Center, we are laser focused on prevention, coordinated care, and independence to keep Americans healthy and help every person age well. Most of us will need care or provide care, often in the same season of life. At NCOA, we're committed to supporting the full spectrum of care, uplifting family caregivers, and building a strong, respected care workforce. And we're so appreciative to do that in partnership with you and your team, Mary. Thank you.
Thank you, lady. Appreciate you. And finally, we come to the point where our members of Congress will speak to us on this issue. Without them, all of these wonderful support services would not be possible. They are our supporters. They make it possible for the Administration for Community Living to exist and support these national leaders. So first, I'd like to introduce Congressman Mike Bost. Congressman Bost is the chairman of the House Committee on Veterans Affairs. And I will also introduce Senator Shelley Capito, who is the chairwoman of the Labor and HHS Appropriations Subcommittee. Both of these individuals are people who are champions on caregivers. Senator Capito is a co-chair of the Assisting Caregivers Today caucus, and this is a caucus which educates members of Congress on the issues facing caregivers as well as direct care workers, what we've heard about today. Congressman Mike Bost has championed many of the issues facing caregivers and supports veteran caregivers to the hilt, I shall say, and we welcome both of them today. Congressman Bost, thank you very much, sir, for being here today. Thank you. You're going to go first.
I go first?
Yes.
All right, good.
Well, first off, thanks for inviting me. And let me tell you, our veterans caregivers are the unsung heroes. So many people don't understand when you have someone who has been injured or who has, well, look, let me tell you, it's very personal to me. Caregivers have a 24/7 job that people really, really, really don't understand. And that's why it was so easy for me to fight for the Dole Act. You know, the Dole Act, when I say it's personal, you know, it's personal for her too. And that's why it was so great to name that bill after her. That's where inside a home that has a veteran, you can either have the experience where you have to have that veteran, where you have to take care of them day and night right off the start, or their condition can worsen as life goes on and those problems continue to get worse. And that's the case with me, why I say it's so personal. So I'm a Marine. And let me tell you that I have a son who's a Marine. Matter of fact, Tuesday, my second grandson will be graduating from Marine Corps boot camp. So it's kind of a family thing. Hoorah. But my uncle, who was a victim of the ultimate oxymoron in Vietnam, friendly fire. U.S. mortar round went off behind him in 1966. He woke up 8 weeks later in a hospital here in Virginia and had no peripheral vision, metal plate in the back of his head, but has had, because of the VA, a very successful life. He's been a successful business person, everything like that, but once again, as you age, the family needs to be able to take care of him. It could have been a whole lot worse, is what I'm saying. And that many of you in this audience know that it can be a whole lot worse. But let me tell you, my job is to continue to fight to make sure. So many times people look at the VA and they will say things, well, they need that, and yes, we want to take care of our veterans. And oh my gosh, whatever you do, don't talk bad about the VA. Well, no. Sometimes the VA makes mistakes. With all due respect to my secretary here who wants to correct those mistakes. But let me explain this. The VA, unfortunately, at times, people feel that it was created for the bureaucrats and not the veteran. And it's my job to make sure that the veterans are taken care of. If the bureaucrats can bring the arguments forward, that's fine. And understand, but the final drive needs to be of everyone that works at the VA for the veterans themselves. That's why it's there. Look, our job at VA is pretty straightforward. It was created so that we can try to do the best we can for those people who have stepped forward to serve this country so that their life can be as near to the life it would have been before the day they raised their arm and took the oath. I will continue to work to do that. I'm looking so forward to continuing to work for you. Let me tell you this. This truck driver's son never thought he'd be in Congress. There's a whole list of people that didn't think I'd be in Congress, but that's a whole different story. But I guarantee you, this corporal never thought he'd be chairman of the VA either. But I know who I serve, and it is your families and your veterans. Thank you.
And Senator Shelley Capito, who is chairwoman of the House Committee,
That's all right.
of Labor and HHS Subcommittee Appropriations. Thank you so much for being here.
Thank you. Thank you all. And Mike, it's great to be with you from the House side. It's great to be here with Secretary Kennedy and Secretary Collins, and mostly all of you. So I know that everybody here in this room, or you wouldn't be here today, has been impacted by being a caregiver or having to have a caregiver. And your work is so very important. I kind of approach things in my service as a senator, usually in a very personal way. So caregiving is very personal to me. Both of my parents suffered from Alzheimer's, and I'm sure that many of you in the audience have had that same experience within your same families. And it falls to the families in most cases, with some help with professional caregivers, to really care for what can be a very long and very painful journey. And it's no different whether you're caring for somebody who's with disabilities or a child or others. But I always have the framework of caregivers of that generation who are caring for their parents as they age. So it's been important to me as chair of the Labor HHS Subcommittee to make sure that we have adequate funding for the research and development. I was just talking to the secretary about biomedical research for Alzheimer's disease and also for Parkinson's. And I am the co-chair of the Assisting Caregivers Today caucus, the ACT caucus, of which we have several members. So you know what? 63 million adults are caregivers in this country. The average age of a caregiver is 51. I guess I could say, oh, to be 51 again. But 51 is still not a young person, and 61% of those caregivers are women. In West Virginia, 1/4 of our adults are family caregivers, and 375,000 West Virginians are involved. So when my parents aged at the end of their lives, I was acting as their caregiver, along with doing all the things that many of us do, caring for my own family, a job, and trying to figure out how to do the insurance, the health care, the hospital visits, the daily respite care. And I know how difficult it is to care for a loved one. And it's not just a physical burden in some ways, or even a physical task. I shouldn't call it a burden. It's very emotional and it's very mental at the same time. And it can be extremely expensive. That's why I joined Senator Bennett of Colorado in introducing the Credit for Caring Act, which is a bill that would give a $5,000 non-refundable tax credit for those working family caregivers to try to help just a little bit boost the economic burdens of caregiving. So you could have access to a home health aide, adult daycare, respite care, or maybe a wheelchair, a ramp needed to get into the home, something to prevent a fall in the shower, you name it. That tax credit could help with that. So to all the caregivers who have helped their families and will help their families, a giant thank you from me. It takes a lot of patience, grace, and love, mostly love, I think, just to get through the days and the hours and the nights a lot of times to meet the challenges of caregiving. Your dedication and commitment to serving people, whether you're a veteran or just or not, is the care that's needed that I think sometimes family caregivers can give is second to none. So the relief that are provided to struggling people and to struggling families is irreplaceable. And we want to help you and help all of the caregivers all across the nation be better, be stronger, and be able to give the love and care that they want to give to their loved one as they're facing the challenges in some of their difficult days ahead. So thank you all very much. I'm very pleased to be here. Thank you.
Thank you, Senator. And now, ladies and gentlemen, it is my just tremendous honor and privilege to introduce to you a bulldog. Senator Douglas Collins, I know he's a bulldog fan because I heard him talk about that on TV one Saturday morning, standing there with veterans and proudly opening his vest to say, I'm a bulldog fan. And it takes a bulldog to be the Secretary of the Veterans Administration and do all that Congressman Bost has just addressed, as well as we have experienced some of the beauty of the veteran caregiving services. ACL works, as you have heard, in partnership with the VA on the Veteran-Directed Care Program. What a tremendous collaboration that has been. The Secretary has extended the act that provides legacy participants access to caregiving services for yet another 3 years. These kinds of acts are tremendous supports to the 63 million that the Senator just addressed. And so I won't take another second away from us hearing from Secretary Collins. Thank you, sir, for being here. Thank you.
Appreciate that. How's everybody this morning? Oh, come on. It's nice that you're in here. It's nice. So how's everybody this morning? Go Dogs. I tried. It's good to be here, and good, Mike and Shelley. It's good to be with y'all, Mary. Thank you for that, and to be here with Bobby. It's our partnership has been great, and I'm looking forward to it even more. Look, the VA is the largest health care in the country. We do it more in different ways than anybody else. Everybody likes to say that, well, my health care is this. No, VA's largest. And you know what the one thing, though, is that Mike actually addressed? Is that we may be the largest with hospitals and clinics, but, folks, we haven't acted like it. We haven't been the best. When you're the biggest, you go back and you look at what we have the resources, the materials, and everything else to be the absolute best for veterans and their caregivers. And I'll be just blunt with you, we haven't always met the mark. We haven't always been there because we acted too much like interdependent hospitals as if they were startups. We had 170-something hospitals, and I've told all of my leadership, I said, you are not the startup hospital. You're part of the VA, and we're going to start acting like it. And one of the areas that we've had a great time is the great leadership from Shelley, from when we served together in the House and now in the Senate, but also my chairman, who is a dear friend of mine, that we work together, is we've been able to do some things that I think are really exciting going forward, that has taken the work of the committees in the House and the Senate, but also I don't anymore, as I was in the House for 8 years, I don't have to find 218 votes, I just have to find my pen sometimes. And if I can find my pen, I can do it, and I give y'all credit, but we're going to get it done. And one of the things that we've been working on, and we're talking about caregivers, and all of us are caregivers in some way. If you think about that for a moment, everyone really is a caregiver. Some of us just have different ways of doing it. And you say, well, Doug, maybe you don't know my situation. I didn't know it either till 33 years ago, till a daughter was born with spina bifida. And this guy who had always been sort of shy around people who had physical disabilities, all of a sudden was the dad to a beautiful little girl named Jordan. I found out for those in a wheelchair that 12 inches might as well be 12 miles because a wheelchair doesn't go over stairs. We walked for years in high school and elementary school, going to the meetings and saying, you know, why do we need this? She needs to go to the bathroom here. We had a caregiver here. And then always would have this. And how many of you caregivers have gotten this? Well, just don't push so hard. They're okay. And they used to tell my daughter, they used to tell my wife, and my wife is a teacher, and they tell me, if you don't push her, she'll be fine. And I looked at them one day in the eye and I said this. I said, here's the difference between you and I. You can love my daughter, you can help my daughter, you can be with her all day. But I said, here's the big deal. When she comes home at night, if Lisa and I die tomorrow, she will only have what I and my wife have given to her, because that's all that we have to do. Caregivers have a big responsibility. So when I looked at that from the VA perspective, I started looking at the things we do. And I see Miss Linda here, who I told somebody just a few minutes ago, Bobby, that if Linda Davis was not at a caregiver event, the caregiver event didn't happen in Washington, D.C. And I just want to thank Miss Linda for that, for what she does for us. One of the things we were saying is we've already started implementing the Dole Act. We're well ahead of schedule on some areas that we're looking at to make sure that that is going well. We've also already extended out caregiver protection for over 3 more years. But then we've also begun to look at it in our health care, incorporating the caregiver into our medical decisions as well. Back in May, we started best medical interest for our veterans. Now, we only have a specific group. We can only take care of veterans, but that's sort of an anomaly because we take care of the veteran, but we have the families as well. And so for us, we said best medical interest in that community care aspect, sending them people to community care. We were bound by miles and bound by distance and bound by time and appointments and all this other stuff. And so I just said, look, I said, the best way we can look at this right now is let's incorporate what the Access Act and others are going to do here as it gets codified. We already went ahead of them. They gave us a great idea. We're just going to say, hey, we're going to get there. And said best medical interest incorporates caregiver input. So it's not just the veteran who says, I'd like to see my doctor in my hometown. I'm getting older and I can't drive. We're actually taking into account, and it says specifically in what I've told our doctors, is if it's best for the veteran and the caregiver. So these are the kind of things that we're looking at as we move forward. There's a lot more that we can do. And there will be more that we can do as we expand out into the areas of caregiver through the Dole Act and also through many of the things that are affecting our hospitals and our community care, and also for many that will join it in our community living centers, our nursing homes, and others, as we have an aging veteran population, but also a veteran population that came back with injuries that we never knew that you could live through, and now we're dealing with them as they go. So I will just say this. The VA is not perfect, but the VA is moving. For those of you with disability claims, we've cut it 160,000 in backlog disability claims in just 5 months. We said we're going to get to it. We're going to make veterans have better care and get the decisions quicker. We're getting you into community better. But at the end of the day, Mike brought this up a second ago from the committee perspective. As someone who served in Congress for 8 years, he's right on. The great part I get to, and Bobby may be a little jealous because I think I have the best job in the cabinet, because I just get to take care of veterans. I get to take care of those like myself who raised the right hand and said, I'm going to serve. I'm going to leave my home and go serve. And we're going to continue to do that. Caregivers will always be a part, because just like for the military on our side, the military on our side is not just about the member who deploys or the member who serves. It's the family that goes along with it, and the extended family that goes along with it. And even sometimes the neighbor who steps up when there's no family member involved, and that's a caregiver too. As we look at that going ahead, that's just where we need to be. That's what our country owes, not only our citizenry, but our veterans in particular. So we got a long ways to go. VA's not still right where it needs to be, but it's going to be, because I work every day to make sure it is, along with our partners in the House and the Senate, to make it happen. Because if we don't work together, then our whole country sort of falls apart. Just like those who are in this room today, who've done stuff this morning that probably others outside this building wouldn't know about. It's okay. Cleaning up, fixing, getting dressed, all those things that caregiver takes, from paperwork to appointments, is not lost on this administration and not lost where we have. And that's why I'm so glad that this month we've put one thing together first, and that is put the veteran first at VA and put our caregivers right next to them. Thank you all so much.
Thank you. Appreciate you very much.
Thank you.
You need your secretary? She needs her secretary.
I mean, I'm a Georgia boy, but you're Southern Illinois. I'm practicing. Y'all take care. See y'all.
Thank you, Mr. Secretary. You are speaking to a crowd who's just emotionally thrilled to hear what you have talked about. What I'd like to do now is introduce our great leader of HHS. And if you've heard me talk before to introduce Secretary Kennedy, I often will say, you know, there are a lot of things in common that the Secretary and I have. We're both Irish Catholic. We both grew up with families, siblings, 11 kids in our family, 11 kids in his family. We both had fathers named Robert, and other things we have in common. Like the Secretary can do 100 push-ups and 100 sit-ups in like under 6 minutes. And I get to introduce the man who is leading a nation to better health, Secretary Robert Kennedy. Thank you, sir.
Good morning, everybody. And I want to say thank you to Secretary Collins, who was called out on an emergency. But one of the great pleasures that I've had in serving in this cabinet is the collaborations that we've been able to do between the VA and HHS, with many, many more to come. I want to thank you, Senator Capito and Congressman Bowles, for being here today and for your leadership on this issue. Today, we gather to announce a new program to support the millions of Americans who devote their lives to caring for our wounded warriors and other family members and friends who are suffering from disabilities. 63 million Americans provide essential daily care to family members, friends, and neighbors across the nation. And that's nearly 1 in every 4 Americans, with 66% of them being women. These heroes they're sick, they're aging, they're disabled loved ones in living rooms, kitchens, and bedrooms. They don't make headlines and they don't ask for recognition. I'm particularly grateful to the family members and friends and paid professionals who took care of my late mother during the last 2 years of her life when she could no longer take care of herself. My grandmother, who lived to be 104 and had many years when she needed extra help, 24-hour care, and my grandfather, who had a stroke when he was 71 years old and then lived for 7 more years with family members and friends acting as 24-hour caregivers. My life and the life of my family has been touched by those caregivers, as have almost every American. But this informal network of caregivers forms the largest caregiving workforce in the United States, a force bound not by salary or title, but by love and loyalty and duty and compassion. Each day, caregivers take on an incredible range of responsibilities, as I saw in my family, from bathing, feeding, keeping loved ones safe, managing complex medical care at home, getting loved ones up and down the staircases, tube feedings, wound care, respiratory treatments, and others. Caregivers are the foundations of America's healthcare system. Without them, our hospitals, our nursing homes, our clinics would collapse from excess demand. But caregivers struggle. Many caregivers work around the clock, 24 hours a day, 7 days a week, taking care of their loved ones with lifelong disabilities, dementia, or chronic illness. Too many lose their income, their job, their aspirations and ambitions for themselves, and even their own health in the process. It's a known fact that caregivers' duties impact both physical and mental health. Only 1 in 4 caregivers reports good physical health, and only 1 in 5 rates themselves highly at eating healthily or exercising. Almost half of caregivers have experienced increased anxiety, depression, and other mental health issues just in this past year. We already face a nationwide shortage of nurses, aides, and healthcare workers. Mercer estimates that by 2028, we'll have a deficit of 100,000 healthcare workers in this country. And direct care workers and support professionals also form the backbone of our support network. These trained men and women help people with disabilities live independently and to participate fully in their communities. They are essential partners. We must do what we can to support caregivers. The Trump administration is pro-family, and there's nothing more pro-family than making sure that your loved ones are taken care of in their time of need. At HHS, we are committed to elevating your voices, strengthening your values, and ensuring that you have the tools and support that you need to meet the growing demand for care. This includes peer support groups, respite care, technology that lightens your load, education and counseling for those under constant stress. And today we take a new step. Through the administration of community living and the leadership of Mary Lazar, HHS is launching the Caregiver AI Challenge, a national competition to spark innovation and to find the next generation of tools that empower caregivers. We're calling on engineers, scientists, innovators, entrepreneurs across the country to harness artificial intelligence to make caregiving smarter, simpler, and more humane. AI can transform caregiving by delivering on-demand support, predicting health risks before they happen, monitoring well-being, and automating paperwork so that caregivers can focus on what matters most, the care and compassion of the people whom they seek to help. This challenge will unfold in 3 phases: design, testing, and scaling. And we will award up to $2 million in prizes to innovations that strengthen care at home for both paid and unpaid caregivers. Our goal is simple: to create tools that are effective, safe, and affordable for every American family that needs them. The Caregiver AI Challenge advances this policy goal. The policy goal is laid out in the Make America Healthy Again strategy report. In the report, the White House directed HHS to use AI to assist in personalized treatment plans, real-time monitoring, and predictive interventions. The report also directed HHS to foster private sector collaboration. Today's announcement will help us achieve both of those goals. AI can change caregiving, but it will never replace compassion. It will never replace the human element. We will champion innovation, but we will never forget that the power of caregiving comes from the human heart, from the hands that lift, the voices that comfort, the love that sustains, and the souls that connect us to the rest of humanity. To America's caregivers, you are not invisible. You are indispensable. HHS stands with you. We honor you. We will keep fighting for you. Together, we will strengthen families, restore dignity, and make sure that every caregiver and every patient receives the respect and support that they deserve. Thank you all very much.
Can we get you run the picture? Yeah, there you go. Thank you. We're going to get you in a picture right here with them. I want to thank all of you for being here today. I want to thank our phenomenal members of Congress for joining us today. We appreciate so much the support that you give to veterans and caregivers, direct care workers, direct service professionals. And Secretary Kennedy, thank you for giving us the opportunity to continue this work. Thank you for announcing the prize challenge, $2 million for initially 10 awardees. And this will continue on for 3 years. First year, these 10 awardees will be awarded, and then they will move on to the next phase of scaling and developing their program. So in total, perhaps $5 to $6 million in prize awards. So again, many thanks for being here. We appreciate all of your support. Thank you.
Thank you. Thank you.
As you leave, you'll see the sign behind you that together we're building a better future.
Produced by the U.S. Department of Health and Human Services.